Om Dham Dhanvantare Namaha. Karpura Gauram Karunavataram Samsarasaram Bhujagendraharam Sadavasantam Hridayaravinде Om Bhavani Sahitam Namami. Acute myocardial infarction due to atherosclerosis or due to spasm. When the blood supply to the myocardium is reduced, severely reduced, then there will be necrosis, well-shaped necrosis of the myocardial cells, known as infarction, myocardial infarction. The myocardial infarction is of two types. It is transmural infarction and subendocardial infarction. Another classification is commonly seen myocardial infarction are anterior wall infarction and inferior wall infarction. So, myocardial infarction, when it is seen in anterior wall, the leads facing the anterior wall show direct changes in the waves, and leads opposite to the infarcted site shows reciprocal changes. For example, in the anterior wall infarction, leads facing the anterior wall are lead 1, lead AVL, V1, V2, V3, V4, V5, V6. And leads opposing the anterior wall are lead 2, 3, and AVL. So in the anterior wall infarction, in the leads facing the anterior wall, that is 1, AVL, and V1 to V6, there will be direct changes. Direct changes are elevation of the ST elevation, and hyperacute T waves within 3 hours, within 6 hours. And after 3 days or 5 days, 1 week, there will be ST depression and T wave inversion. The leads opposing the anterior wall, that is 2, 3, and AVF, there will be reciprocal changes, that is ST depression and T wave inversion. In the inferior wall infarction, on the contrary, leads facing the anterior wall, that is 2, 3, and AVF, there will be direct changes. And leads opposing the inferior wall, that is 1, AVL, and V1, V2, V3, V4, V5, V6, there will be reciprocal changes. That is, in the inferior wall infarction, lead 2, 3, and AVF show direct changes, that is, ST elevation and tau T waves. After 1 week, however, ST depression and T wave inversion takes place. In the inferior wall infarction, the leads opposing the inferior wall, that is 1, AVL, and V1, V2, V3, V4, V5, V6, there will be reciprocal changes, that is ST depression and T wave inversion is seen. More the STT changes, the more leads, more severe is the infarction. Now in this patient, you see lead V1, V2, V3, and V4 shows ST elevation, and V3 and V4 shows tall T waves. That is, it is anterior wall infarction. So in this ECG, lead V1 and V2, V3 and V5, V4 and V5 show ST elevation, T wave inversion. In this ECG, you can see V1, V2, V3. And V4, there is ST elevation. In V4 and V3 and V4, there is tall T waves, resting anterior wall infarction. In this ECG, you see the V3 ST elevation and tall T waves. That is anterior wall infarction, anteroseptal infarction. In this ECG, you can see ST elevation and tall T waves. They are the direct changes in the ECG due to myocardial infarction. So in this, you can see the ST elevation and tall T waves. That is due to myocardial infarction. In this V1, you see there is T wave inversion. That's it. ST wave isolated. T wave inversion. It is reciprocal, maybe that is integral infarction. You see in this ECG, ST segment normal, and ST segment elevation, and ST segment tortuous. In the middle one, you can see ST elevation and tortuous. ST, that is anterior wall infarction. You can see here 2, 3 showing ST elevation. The inferior wall infarction. However, the V2 also you see ST elevation. Here, this lead to 3 AVF shows ST elevation, isn't it? And V1, V2 also shows ST elevation. There is a anterior wall and infra wall. Here you see, here you see 2, 3. And AVF shows tall TV, sorry, ST elevation. That's it. This is issue of inferior wall infarction. And day 1 AVL shows ST, sorry, inverted T waves. Reciprocal things. Here you see, lead 2, 3 and AVF shows ST elevation. And 1 AVL shows ST depression inverted T wave. There is the inferior wall infarction. Here you see the V2, V3, ST depression is there. And in grade 2, 3, AVF, there is ST elevation is also inferior wall infarction. Here you see lead 2, 3 and AVF shows ST elevation tau T wave. Lead 1 AVL shows ST depression inverted T wave. It is inferior wall infarction. Even the V2, V3 shows ST depression. It is inferior wall infarction. Here you see 1 and AVL show ST elevation. Okay. This is suggestive of anterior wall infarction. Okay. Here, so today we have discussed myocardial infarction and anterior wall infarction and inferior wall. The STT changes in anterior wall infarction and inferior wall infarction. Thank you for patient.